Oh, good afternoon, Maria. It's
Hi.
a pleasure to meet you. I wanted to make sure we had a time to sit down and have you come in and discuss some of your past labs and past history regarding this new diagnosis of type 2 diabetes that you have. And I do appreciate you sending these labs ahead of time for me in advance to review these for you so we can make the most effective use of our time on our first visit together. I'm going to cover just a couple of things regarding your past history. Congratulations on your daughter, by the way.
Thank you.
6 years ago, you had gestational diabetes and did very well with through your pregnancy without needing medications and only receiving the care through a registered dietitian. And then it looks like 2 years ago in your labs, you had prediabetes.
Mm-hmm.
You had an A1C that was a 6.2%, so prediabetes would be 5.7 to 6.4%, and yours was 6.2%. And then your blood work that you had done last week that was forwarded to me showed that your A1C was 7.1%. And at 7.1%, you do have diabetes because 6.5 and greater would be type 2 diabetes. So we do have, risk factors within a family history. I see that Dad had diabetes, two sisters had diabetes, and then you've got some sisters also that had diabetes as well. So obviously the risk factors are there. We can't change our risk factors. We don't pick our parents. So we kind of move forward with what we have now. So the important thing is looking to how do we get our A1C down and prevent complications of diabetes, and mainly there's microvascular risk of blindness, kidney failure, and amputation. And these things don't happen right away. These things happen, with uncontrolled blood sugars for numerous of years, 10 plus years before you really start seeing complications, take place. So I know you're a dentist, you got a full-time practice, you got your daughter, so you're probably quite busy. And it says here that you had actually tried a little bit of lifestyle intervention. Is that correct?
That's true.
And did it not work out well for you, or?
It's hard. I'm just really busy. I'm a busy schedule. I tried. It's just really hard with my schedule.
Right. So. Yeah. So sometimes we can just do the best of what we have, and you were able to. Looks like about 9 pounds. I think is what you had lost at that time, and not taking any medications for anything. You have a history of look like maybe some irritable bowel syndrome a little bit. So I think before we really engage in what medications are available in diabetes, I think we always want to make sure we address appropriate time and attention to the importance of lifestyle intervention for disease progression. And really, there's a program called the Diabetes Prevention Program, a study that was done looking at pre-diabetes patients, similar to yourself 2 years ago. And how do we prevent diabetes from taking hold through lifestyle intervention? And just briefly, in this particular study, there was 3 groups within the study. The first one in this control group is which the patient received basically a page of information, if you will, that talked about these are the type of things you should do with our diet, and this is how much you should exercise. And then the second group within the study was a group that was on Metformin, which is, of course, the most common used diabetes medication, which you do sound familiar with, so you're agreeing with me here. So Metformin, up to 850 twice daily. And then the third group was what we call the intensive lifestyle intervention group. And those patients actually had individual sessions with a dietitian groups. They also were recommended to exercise 150 or more minutes per week, even through walking, and only have to lose, for example, 7%. So a 200-pound patient would only have to lose 14 pounds. So it seems quite small. We want to find out what the chances are of decreasing prediabetes to diabetes. And what we found out in the Metformin group is that there's a 31% reduction in converting from prediabetes to diabetes. But interestingly, in the lifestyle intervention group, it was 58%. Now, it's much harder to change lifestyle than it is to swallow 2 pills per day, but the point being made is that lifestyle intervention is critical from the outset and along the way as we start talking about adding medications within diabetes.
Okay.
Does that make sense
Yes.
as far as how we've gone? And not to be critical of patients when we're talking about lifestyle, because I understand the rigorous lifestyles that people have and trying to accommodate everybody in their life. It's just important that if we can put some of those components in there, it actually helps a lot of our initial therapies work a bit better.
Okay.
Okay,